Bowhead Futures presents digital health at the front lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out.
There's so much happening in the public sphere right now, and I'm sure you're following, the movement from sort of WhatsApp to Telegram and Signal, and people are finally starting to understand privacy, like take action on some of these concepts and ideas that have been kind of flowing around. Just talking about surveillance and tracking. I'm curious if you have any thoughts there.
So I think, again, I'd advocate for patients being a key stakeholder here, right? There has to be not only a buy-in, but there has to be a proactive approach to ensure that folks want to use the system. I think a good example is the contact tracing app that was released by Health Canada. So this app came out, the app is wonderful, but I just don't know if our societies are ready for it. So it's needed, it's important. We released it in a pandemic. There's questions around security in general. Folks are worried about, if I input this information, and they've done a wonderful job at de-identifying the data. I can't poke any holes in this app. Like, it's so well designed. Folks are protected. It's a wonderful warning system, but we haven't had the uptake, right? And you're talking about a society that is generally glued for the most part to their phone, right? So it would be great to know, in terms of the folks who have downloaded the app, what is the demographic, right? Do we have a ton of people under the age of 30 not downloading the app when we know that these folks are constantly using Facebook, Instagram, Google, etc. on their phones anyway? So what's stopping them from logging in every day to say yes, yes, no to certain questionnaires, screening questions, and informing our response, right? What is that capacity that we need to build up? Does it even exist? So your data is being collected. In some cases, it's being tracked. Here's who houses it, but also you should have access to it, right? It's technically your data, like there's sole ownership here. So Rhea owns her data, right? Nitin owns his data, and so then do I have the right to release it, right? So can I opt into releasing it? Can I opt into holding it? Here are the benefits and risks of releasing it. If you hold it, here's what we won't be able to do, right? And I think that's one of those upstream approaches, is that we have this tool that's going to be wonderful for us in healthcare, but if that buy-in and understanding isn't there from the population level, it becomes almost a perfect storm that's going to be brewing, and then we're going to have to counter in the very near future.
Yeah, and that's where I think the role of education comes in, right? And being incredibly transparent in communication, like for innovators of these technologies actually coming in, and what we do is we're incredibly clear. Do you consent to sharing your data, contributing your data towards research, and your anonymized data towards research, yeah. Right? So what we learn is that people are actually much more interested in participating in their health if they're just feeling like they're part of the conversation. So I think there's a communication piece. There's probably an education piece. I think because of what's happening in the media, people are just scared in general, and they're thinking that we're looking at what's happening in China, the social scoring, and we're thinking, well, could this happen here? And I think that's an okay thing to be worried about, because again, we just don't have the right education to understand that there are differences.
The ethical considerations are quite monumental here, right? Because private industry would be able to do a lot with this information, right? Whether it's insurance companies, any institution you think of, right? So if you're a health insurance or life insurance company, it would be in your benefit to understand someone's health literacy, right? So if there's an app that tracks, if there's an app that can track that would be great for you to have that information, because you can decrease potential risk and payouts, et cetera, right? And so I think this is another way we can use health tech and the digital sort of revolution we're about to see in healthcare, is to really build up that level of capacity, right? And I think for the most part, the generations coming up, the upstream approach, folks have the ability to access tools and use internet is great. It'll really be in the demographic that has difficulty with that right now. Yeah. And again, it sort of highlights the societal issues where internet needs to be a basic human right now. It should be provided. We shouldn't have these discussions.
Exactly. You hear that?